You know, behind every single doctor's visit, there's this huge, almost invisible system humming along in the background. It's really the financial engine of healthcare. And today, we're going to pull back the curtain on the three critical jobs that make it all run.
Think about it. You leave the clinic, right? Maybe you've got a prescription, maybe a follow-up appointment, and for you, the story is pretty much over. But in reality, a whole new, complex process is just kicking off. So how does the care you just got get translated into something the healthcare system can actually understand, process, and, well, get paid for?
Well, that's where our three key players come in: the coder, the biller, and the credentialing specialist. Now, each one has a unique and absolutely essential job, and they all have to work together to keep the wheels of the industry turning. So let's break them down one by one.
All right, Section 1, from care into code. Our journey really starts the moment your appointment ends. The very first step is to take everything that just happened, the chat with your doctor, the tests they ran, the final diagnosis, and turn all of it into a universal language. And that is the world of medical coding.
A medical coder is, for all intents and purposes, a professional translator. They take all those detailed notes from your doctor, all the lab results, and they convert them into these standardized alphanumeric codes. Their whole job is to read your medical story and capture it perfectly using this universal system.
And coders have to be fluent in a few different languages. You've got ICD-10 codes, which are for diagnoses. Think things like strep throat or high blood pressure. Then there are CPT and HCPCS codes for procedures and supplies. I mean, everything from a simple blood draw to major surgery. And this standardization is absolutely crucial. It means a diagnosis made in California is understood the exact same way in New York.
So a great way to think about it is this: coding turns your personal healthcare experience into structured, usable data. And that data becomes the foundation for literally everything that follows. Without accurate coding, the whole system just falls apart.
Okay, so once we have those codes, we've got the raw material for the financial part of this whole journey. This is exactly where the medical biller steps in, and their job is to turn those codes into payment for the provider. The medical biller takes the codes that the coder just created and uses them to build an insurance claim. You can just think of it as a super detailed invoice for the insurance company. This claim spells out exactly what services were provided so that the doctor or hospital can get reimbursed for their work. So if coders are turning care into data, billers are the ones turning that data into payments. They are the absolutely crucial link between the medical services that were provided and the financial health of the clinic or hospital. But it's not as simple as just, sending a bill and calling it a day. The biller's workflow is a whole process. They create and submit the claim, but then they have to follow up. A big part of their job is managing any claims that get denied and filing appeals when they need to. And finally, when a payment does come through, they post it to the right account. They're really the provider's financial advocate in all of this.
Now there's one more key piece to this entire puzzle, and it's a process that happens before a doctor can even see a patient or send out a single bill. This is called credentialing, and it's the provider's official green light.
Credentialing is all about verification. See, before an insurance company will agree to pay a doctor, they need solid proof that the doctor is who they say they are. This means checking their medical license, their education, their training, and making sure there's no history of malpractice. It is a critical trust and safety step.
So credentialing is essentially the gatekeeper. It's the process that grants providers the official approval they need to both treat patients who have a specific insurance plan and, just as importantly, to bill for those services. Without successful credentialing, a provider is basically invisible to that insurance network.
Okay, so we've looked at each role on its own. Now let's put it all together and see how this system really clicks into place, because the real power is in how they all work in harmony.
This table lays it out so clearly. It all starts with credentialing, which takes a provider's qualifications as its input and outputs an approval to bill. Then, for every single patient, coding takes the chart notes as input and outputs those standardized codes. And what does billing use for its input? You got it, those codes. The output? Insurance claims, and hopefully, payments. Each role's output is the next role's input. It's a perfect chain reaction. And this is what it all adds up to: the healthcare revenue cycle. It's this continuous loop that starts with you, the patient, getting care. That care gets turned into a claim through coding and billing, which then results in a payment, and that allows the provider to keep offering care. It is the lifeblood of the entire healthcare system.
So what's next? As technology and AI get better and better at reading charts and processing claims, it brings up a really big question. Could a single AI system one day handle all three of these jobs at once? The verification, the translation, and the financial transactions? It's a fascinating thought about the future of health